Okay. So the injection was done in the eye that was damaged, or the one that was suffering this wet AMD. And of course, some patients come with both eyes that have the disease, so we treat one and then we treat the other. And yes. And
we have a reading test.
Oh.
And all these tests.
Yes. Oh. So you mean this test?
Yeah, 2 eyes or 1 eye.
No, excuse me, monocular vision. So we cover one of the eyes and then we make the patient read with the eye that has the disease, what we suspect that has the disease. Thank you.
Any more questions?
So was the treatment effective in all the cases, or is there any which was not effective, and if there was, why? What can be the cause of the ineffectiveness?
Wait a second.
Yes, the treatment was effective in most of the cases, but sometimes we have, once you give the injection, you have 80% of chances that this injection is going to be positive to the patient. Then you have a 10 to 15% when it's going to be, it will not cause anything, because the patient is not sensitive enough to this drug. And in this 80%, 40% out of this whole will be highly significant, so they will improve very, very much. And in this case, we had patient number 10, for example. As you can see, his thickness was 276 before injection. It increased. It doesn't mean that the drug is not effective or the drug is bothering the patient. It simply means that his disease is evolving, maybe slower, but some patients are not sensitive to the anti-VEGF. And this is why nowadays there are new researchers that are pushing to have, in my previous study, seen PEDF, photoreceptor epithelial-derived growth factor. They're trying to combine those two drugs together to improve people's visual acuity. Thank you.
Thank you very much. One question? Yeah, one more.
Two short questions. How expensive an injection like this for a patient? And the other one, did you notice any side effects of the injection? Or did you ask the patients about the side effects?
It depends where you are. In Hungary, unfortunately, it's not the same like if you were in France or another country. The healthcare system, well, I don't want to go into detail because I do not wish to criticize any healthcare system in the world, but some healthcare systems are better than others. In certain cases, an injection could be around hundreds of euros, or it depends where you are. I cannot give you an exact number for that. But about the side effects, well, until now, some of the patients we didn't investigate that much into this, but of course, the side effect of having an injection into your eye would be scarring around the area, because you're injecting a foreign object into your eye. So after a while, most of the patients come and there's a scar, but it's not visible on the outside. You have to check with the fundus. So this would be the side effect. Thank you.
Thank you very much. Thank you very much for your very nice presentation. We have to go further. És akkor az utolsó feladatot utána fogunk várni. Az ösztrogén analóg DHED neurológiai vizsgálatot